Dr. Catherine Anderson, President of the Royal College of Emergency. Dr. Dakshinamurthy Vijay Shankar. Dr. Manoj Sandaraj.
Thank you so much.
Mrs. Victoria Devitt, International Officer and Training Coordinator of the Royal College of Emergency Medicine. She's been instrumental in taking the EMFP's logistics and coordination. Thank you so much.
We reciprocate.
Yeah.
Is that all right? We do that now. Of course, we do that.
Thank you so much.
The Royal College is presenting the money for 2 of our officers. This is
Coming to this picture, all of you please come. Yeah, come, yeah. Come. This is all. Is there someone else? Come. Julia, the story is not complete without you. Come. All the best. Thank you. So this will move from location to location. So this is
We have to hear some of the trainees. So there are a few trainees who wanted to speak. So let us invite Dr. Medha. Honor of experience. Dr. Medha is from the first batch of the EMFP program.
A very good afternoon to everyone present here, all the dignitaries on and off the dais. As a graduate of this Pioneer Institute, I feel highly privileged to welcome the President of Royal College, Dr. Reddy, and the team. So, I'm deeply obliged that the Royal College of Emergency Medicine and the team kindly consented to spare their valuable time for this occasion. As an institute, Apollo has grown and maintained its enviable position in all the 3 facets of providing medical care to patients, showing their unflinching faith and their capacities in capabilities in the doctors of this institute. The Emergency Medicine Foundation program has enabled trainees to focus on the learning of those aspects of basic clinical relevance in professional practice, which was established involving the senior emergency medicine clinicians. At the end of this program, you will be equipped to safely and speedily interpret many common clinical presentations. This program constitutes a benchmark of knowledge for your future professional and personal development as well. Our department and staff have continuously been giving us many opportunities of learning this subject, out of which I would personally like to thank our head Dr. Imran for enrolling all of us into this program, where learning about patient encounters, specialty consultant care, teamwork, academic sessions, meetings, CMEs, conferences, workshops, and all have been a part of this program, which has immensely helped me in the development of my personality towards care for every patient I give. Ladies and gentlemen, I feel very proud when I say that this institute and department has produced some world-renowned professionals occupying top-notch positions and serving mankind across the globe. I am sure the students now being conferred degrees would carry forward the legacy of their procedures and make their own name in the field of emergency medicine and the institute proud. My father always said, those who suffer need you to be more something than a doctor. They need you to be a healer, and to become a healer, you must do something more difficult than putting your white coat on. Yes, you must recover, embrace, treasure the memory of your shared frail humanity, of the dignity in each and every soul. So before I close, I would like to congratulate and thank our consultants, clinical and educational supervisors for their immense efforts towards this course, without whom this program would never be a success. Thank you so much.
Dr. Bharat, stage.
Good afternoon and welcome everybody. Emergency Medicine Foundation program has made me a very good emergency physician, improving my clinical and decision-making skills, procedural skills, anticipation of the life-threatening emergencies, and then management to the patients. Methodology and right way to approach the patients are also improved throughout the program. The program functioning has helped me to understand the areas of my weakness and ways to overcome them all through the year of the course. Learning new aspects and methods to improve the pace, personal development skills like communication, teaching, guided me by my education and clinical supervisors have made me a perfect working professional. I was involved in research activities and administration activities as well along with the program. Thanks to all my education supervisors, clinical supervisors and head of the department and the consultants for their intense support in making me a wonderful emergency physician. Thank you.
Can I call Dr. Leanne Zakaria, EMFP?
Dr. Henderson and team, Dr. Imran and other heads of departments, and my fellow colleagues. Good afternoon. Thank you for this opportunity to be able to address you. It takes a fateful event for the least of us to have instilled in us a dogged determination to overcome the challenge, and that determination is to help save a life, and the desire to equip oneself with skills to prevent an unnecessary death. This is where I was fortunate enough to be admitted into the Emergency Medicine Foundation program in Apollo Hospitals. Now into my third year of the RCEM course, I have been privileged to be exposed to medical emergency skills that I believe are the best in the country. Led by a team of experts par excellence, I have been immersed in competent guidance in the emergency room. Through the EMFP program, I was provided with regular classroom lectures and organized practical exposure to a wide variety of cases. I take this opportunity to thank Dr. Henderson and her extended team for giving each and every one of us in this room a chance to be able to make a difference. Sometimes the very difference between life and death.
Dr. Sai Kiran.
Good afternoon, everyone. Thank you, RCEM team, for promoting emergency medicine in India. My name is Dr. Sai Kiran. I am from second batch of EMFP. I graduated from a newly established medical college and completed my graduation. And through one of my friend, Srinivas, actually I entered into the emergency medicine in Apollo Hospitals. And when I remembered my initial days of residency in Apollo Hospitals, where when I saw a patient achieving loss, which I never heard or seen before, and went to my HOD and asked what's happening, and then I got to know Apollo Hospitals was resuscitating patients and saving many lives from many years. Even before I joined into the emergency. Even I joined into the undergraduation. Under my education and clinical supervisors, I successfully completed my EMFP program. I really overwhelmed when, as a team, we saved a patient, Salome, her name, and she was suffering with postpartum cardiomyopathy. And in front of us, she went into cardiac arrest, and as a team, we saved her life. On 18/12, it happened, and actually she gave birth to a child on 17/12/2021. If I say it's not me, EMFP saved a life, gave mother to her child. It's definitely no exaggeration in this. I was really motivated with the EMFP program, and I'm looking forward to complete my MRC. Thank you everyone for giving the opportunity.
Any experience by our supervisors, Dr. Sudhir, Dr. Subhareddy? An experience, you have trained so many people. Our supervisors have underwent 2 separate workshops in order to certify them as supervisors, and then they were all supervising the trainees when they come into intensive care units, emergency departments, anesthetics. So we have Dr. Subhareddy, he is the head of the critical care department at Apollo Hospitals.
Good afternoon all. We have excellent emergency department at Apollo Hospitals, and these emergency trainees, they come to our intensive care unit, and we have 14 different intensive care units at Apollo Hospitals, and all these students are rotated in different intensive care units. We have transplant ICU, we have advanced critical care unit, we have different medical intensive care units, we have cardiothoracic intensive care, we have neuro intensive care. They get vast experience when they get rotated in all the intensive care units. And we are fortunate to have this program in Apollo Hospitals. Because of these trainees, we get able to manage so many ICUs, and we like if you see the nighttime care in the hospital, in the intensive care units, and in many hospitals they manage their ICUs with MBBS doctors and without any training. But we are fortunate to have these residents in our intensive care units, and our standard of intensive care at Apollo Hospital has increased because of you. And thank you so much for supporting us, and we are always there in training all of you. Thank you so much.
I'd like to call another very important person, Dr. Ravindra Babu. He is our Director for Medical Services and a backbone for all the medical teams, especially emergency teams, to speak to the audience.
I should say the emergency team is doing a very, very wonderful job. When the COVID started, when the first case we received in Secunderabad Apollo, that's when we were all scared. You know, we knew that our lives were at risk. A lot of apprehension, or a lot of suspicion among the doctors, nurses, staff, administrators. But the emergency department never had a second look. They were the first people to just be there. I think Imran and his team were there. There was no need for us to tell, okay, patients are going to come, we need to take care of this COVID patients. But they were always there taking care of the patients. I could see that, not a single doctor in the emergency not affected by the COVID. Actually, all of them, there was always 3 or 4 people in the suffering with COVID, but the rest of the team continued to take care of the patients. Some of them actually serious, they were on oxygen. This was I think in the second wave we really suffered badly. They were always there, and I think this is the special batch. I think these people deserve a lot of patience. They really put their life in front of the patients and took care of them, and God bless them.
Thank you very much, sir. Dr. Ravindra Babu is one of our oldest examiners for the Royal College, examined from 2007 onwards. Thank you, sir. March 24th of 2020 is when India went into lockdown, and that's when the COVID happened, and we all can write novels and autobiographies about our experiences there. It can be a textbook which we can write, it can't be spoken here. I would like to call Dr. Nitin Jagasia, Head of Emergency Department at Apollo Hospitals, Mumbai, to acknowledge and give tribute to the emergency doctors who worked in the front line during the COVID-19 pandemic.
Thank you. So I think we've already heard a lot of things, but I'll try and summarize them together. The COVID pandemic has changed each and every one of our lives forever, I think. And I strongly believe mostly for the better. When it first struck, I think March 24, like Imran just reminded, I was actually in UK and I flew back on 10th of March. And luckily I made it back, otherwise I would have been there for extra 4 months. So on one hand, the entire population were confined to their homes and all the institutions, businesses, all were shut down. While on the other hand, each and every one of us were the front line. We were out there, and like we've already heard, so many good attributes from the team: adaptive, innovative, ready. Nobody needs to call us. It's so good that we are just growing in numbers, and truly selflessly, just with the determination, we were all out there, and we made processes not just for our department but across the hospital to keep each and every member of staff and member of the community that is having to access medical care as protected as we could. So a huge round of applause to each and every doctor, healthcare worker, and all the family members that have supported them. Definitely countless lives have been saved because of all the efforts that have been done. Unfortunately, being the first line, we've had some excellent healthcare workers that have lost their lives to the pandemic. So I'd like to take this moment, if we could all stand up, and we'll